23 minutes to 7 now, and dentists in England can be back in their surgeries from Monday. According to a British Dental Association survey, though, a third are not ready to reopen. And they face a backlog of patients after weeks of lockdown, as Dan Johnson reports.
Is the Bailiff Bridge Dental Practice. The surgery is now closed.
That's been the message throughout the lockdown.
Normal surgery will not be resuming at this time, despite the government's announcement.
We're waiting for filters to filter the air to come.
And near Halifax, Mike Ehrlich is one of many dentists struggling to reopen on Monday.
Unfortunately, there won't be any patients here. We're hoping that a week's time we might be able to start seeing some of our own emergencies and do some very basic treatment. This waiting room is going to be empty for months.
Even then, ensuring the virus doesn't spread will have a huge impact.
I'd normally see between 50 and 60 patients on an average day. When we start treating people and doing proper treatment with the drill, I think the most I'll be able to see is 5.
Only one patient will be in the surgery at a time. Protective equipment will be repeatedly changed, and there'll be lots more cleaning.
So I reckon we're looking at an hour and a half between each patient.
We've literally just been given the guidance. It's given us less than 1 working day to get things in place.
We've had to do all of this on our own. We've had no help, no guidance.
We're not expecting to see routine care patients for 2 to 3 months.
We will be open on Monday, but it will only be for urgent cases.
Across England, so many dentists say they just aren't ready.
We don't have key worker status. Childcare is a massive problem.
The biggest challenge has been sourcing the correct personal protective equipment, PPE.
Patients will not be able to get through on the telephones because we're expecting it to be very busy.
It's not just a case of just getting a mask and, or opening the doors. We have to get policies in place.
I get to be a dentist today. There are instructions.
And patients have been treating themselves with only limited emergency care available. Linda Hayes recorded her attempt to use a home filling kit.
It came up.
There's now a major backlog, which will take months to clear.
Monday as a deadline to reopen is not really something that they will be able to hit.
Eddie Crouch is vice chair of the British Dental Association.
We estimated that this was going to be a real problem. We didn't realise it was going to be such a problem for our colleagues. Many of my colleagues have moved heaven and earth to actually get the PPE to be able to start seeing patients on Monday. Many have been very frustrated that they haven't been able to do that. And we've been sadly let down with late notification and the operating procedures that we're expected to work to.
Back at Mike's surgery, there's DIY to do, installing more hand sanitisers before picking up the dental drill. One treatment room's now become a store for increasingly expensive protective equipment.
PPE generally is up 1,000%.
There are major questions about covering those costs and the future of funding. England's chief dental officer says dentists wanted to reopen and it's in patients' interests, but the challenges keep multiplying.
We've obviously got to prioritise people in pain, but there are people out there who have paid for treatment, who are mid-treatment, who need stuff doing, who won't get seen for months and months. And it's not because I don't want to, it's just that I want to see them in a safe manner. And it's about my safety, my staff's safety and our patient's safety. And that's what's important.